Ever get that weird feeling like your jaw is puffier than usual and you just can't figure out why?
Yeah, you're not alone. It's actually way more common than people realize. We've been diving deep into some articles about swollen jaws, and let me tell you, some of the reasons are pretty wild. We found 8 potential causes in your research, so ready to unpack them all.
Absolutely, let's get into it.
We're going to separate those everyday reasons from the ones that might make you go, wait, seriously, just to help you figure out what might be going on. So some of these causes, like coming down with a cold or the flu, probably familiar, right?
Yeah, those are the classics. Your body's basically going into defense mode when you've got a viral infection like that. Swollen lymph nodes, maybe some tenderness around your jaw. It's like your immune system is throwing a little party in there.
A party you didn't really RSVP to, though, huh?
Yeah.
Exactly. Not the fun kind of party, that's for
Yeah.
sure. But it's essentially your body trying to fight off those invaders.
So those swollen glands, even though they're annoying, are actually a sign that your body's doing its job. But how do you know when it's just your immune system doing its thing and when it's something more serious?
That's the million-dollar question, right? Like, let's say you have a sore throat, pretty common, but then it gets to the point where it's really hard to swallow or the pain is just awful. That could be a sign of something like an abscess, which is a whole other
An
ballgame.
abscess. Okay, yeah, that sounds way less fun than a cold.
Yeah, those are no joke.
So definitely don't ignore it if you're having those more intense symptoms. Now, while we're talking about things we'd rather not think about, sometimes a swollen jaw can actually be traced back to, ready for this, our teeth.
Oh yeah, those pearly whites can definitely cause some trouble.
Not so pearly when they're causing jaw pain, though.
True that. We're talking things like a tooth abscess or something called pericoronitis.
Okay, those are some words. Let's unpack those, starting with that tooth abscess. What is that exactly?
So imagine a pimple, right? But inside your tooth.
Oh, no, that does not sound pleasant.
Not at all. That's essentially what an abscess is. Bacteria get in, create this pocket of pus, and all that pressure builds up, causing some pretty nasty pain.
Okay, ouch. So you're saying if you're feeling that kind of pain, don't mess around. Get to a dentist. ASAP.
Absolutely. The sooner the better.
Good to know. So what about that other thing, that
Pericoronitis.
Yeah, that one. What's the deal with that?
That one's usually a little less urgent. Remember wisdom teeth? Or the pain of them coming in, at least.
Ugh. Yeah, those were not fun. Actually, a lot of people have trouble with those.
For sure. Pericoronitis is basically just inflamed gums around a tooth that's trying to erupt. Can be uncomfortable, can cause some swelling, but it's usually very treatable.
Okay, well, that is good news. So far, we've covered a bunch of the usual suspects, but what about those sneakier causes, the ones you might not expect? One that really stood out to me was thyroid nodules.
Ah, yes, the thyroid. Such a fascinating little gland.
It's small but mighty, right?
Exactly. Think of it like your body's energy control center,
Yeah.
regulates your metabolism, all sorts of important functions.
Okay, so what are those nodules then?
Nodules are basically just lumps that form on the thyroid gland. Good news is the vast majority of them are benign.
Phew, that is good news. But they can still cause problems though, right?
They can, yeah. And jaw swelling is one of them. You might also notice things like a weird tickling feeling in your throat, or even some ear pain. It's wild how these things are all connected.
It really is. You don't always think about it, but our bodies are pretty complex. It's crazy how all these things can show up in ways we'd never expect, right?
Yeah.
And speaking of unexpected, we were talking about Lyme disease earlier. That one seems like a real curveball when it comes to jaw issues.
It really is, and this is where it gets tricky because those symptoms can seem totally unrelated. You're saying you'd seen some info on this.
Yeah, it popped up a few times in my research.
Well, get this. Jaw pain, even lockjaw in some cases, shows up in something like 25% of Lyme disease cases.
Whoa, 25%. That's way more common than I would have thought.
Right. It's not just about the rash, even though that's what we usually hear about.
Exactly. It really highlights why knowing about those lesser-known symptoms of Lyme disease is so important.
Couldn't agree more. Lyme disease can be sneaky like that. It can present in a ton of different ways.
Okay, so we've covered infections, tooth problems, the thyroid, even Lyme disease. But there's one more potential cause we haven't talked about yet, and I know it can be a bit scary to think about. Cancer. I was reading this article about a woman who went in for a routine dental cleaning, totally thought everything was fine, and her dentist found this tiny white patch inside her cheek. Turned out to be early stage oral cancer, and because they caught it so early, they were able to treat it successfully.
See, that's why those regular checkups are so crucial. Early detection is key. Like you said, it can make all the difference.
It's easy to put those appointments off, but stories like that are a good reminder to stay on top of it.
For sure. And you're right, it's totally understandable to feel a little uneasy talking about cancer.
Yeah.
But, like they say, knowledge is power.
Exactly. So let's talk about it. What do we need to know?
When it comes to oral cancer, which often starts in the cells lining the mouth and throat, jaw swelling can definitely be a symptom. It's important to remember that it doesn't always show up, though. Some of the biggest risk factors are things like tobacco use, drinking alcohol, and HPV infection.
Got it. So those are definitely things to be mindful of. And it sounds like that regular dental checkup is even more important than we might realize.
It really is. Dentists are trained to spot those subtle changes that we might not even notice, and like we were just talking about, that early detection can be life-saving.
Okay, so we've covered a lot of ground here, from the everyday causes of jaw swelling to those more serious possibilities. What are some of the key takeaways you want our listeners to walk away with? So where does all of this leave us? What are the big things to keep in mind if someone's dealing with a swollen jaw?
I'd say the biggest takeaway is don't freak out, but don't ignore it either. Most of the time, it's something that's easy to treat, especially if you catch it early.
So it's all about knowing your body and when to call in the pros.
Yeah, exactly. Like, if you've got a fever, trouble swallowing, or the pain is really bad along with the swelling, those are all signs you need to see a doctor right away.
Makes sense.
But if it seems more like a toothache, then your dentist is the one to call.
Right, so it all comes back to those teeth sometimes. And what if it's not an emergency, but the swelling just won't go away?
I'd say it's always worth getting checked out. Better safe than sorry.
Couldn't agree more.
You know, here's something else to think about, and it might surprise you. Have you ever considered if stress could be playing a role?
Oh, interesting. How so?
Well, we often clench our jaws or grind our teeth without realizing it, especially when we're stressed, and all that tension can lead to jaw pain and, you guessed it, swelling.
Wow, that's a really good point. It's easy to forget how much stress impacts us physically. Well, we covered a lot today. We talked about those common culprits behind a swollen jaw, like infections or tooth problems. But then we also got into those more unexpected causes, like Lyme disease or even those thyroid nodules. And of course, we talked about why it's so important to know the signs of oral cancer and how crucial those regular dental checkups can be.
Absolutely. At the end of the day, it's about having the knowledge to take charge of your own health.
I love that. Knowledge is power. So to everyone listening, if you're dealing with jaw swelling and it's not going away, don't hesitate to reach out to a healthcare professional. They can help you get to the bottom of what's going on and find the best way to treat it. That's all the time we have for today. Until next time, stay curious.